Doctor, if you would stay at the podium, please. The first question's for you. From Michael Bilo of Motif Magazine. Are managers of public or quasi-public housing, often populated by elderly or disabled residents, obligated to notify tenants if someone tests positive? Are managers notified, or does HIPAA prohibit that? There's one more part of the question, but I'll let you start with that.
We work closely with public housing and quasi-public housing facilities to help them understand when it's important to make sure other residents are aware of what's going on, because it can have a direct impact on those residents, versus when to balance that with protecting confidentiality. So that guidance comes directly from us to the entities that we're working with, whether in a housing unit or an employment setting or some other type of facility. It's an important balance to take, knowing that when people need to be made aware because it impacts the outcomes for them, then that's when we advise that to occur.
And the last part of the question is, what is the Department of Health's role in contact tracing if someone declines to cooperate?
Our team is very effective at getting people on board with understanding why the contact tracing steps are needed, how it's going to help us, as I talked about, allowing us to isolate and quarantine the people who have been exposed, and getting people to follow. In the rare situations where we have someone that does not want to cooperate with us, we have steps of enforcement that public health authority allows us to be able to activate if we need to.
Our next question is for the Governor, from Jim Hummel. He asks, has the significant drop in revenue affected the state's ability to issue tax refunds? I've heard from a number of people who filed their returns 1 or 2 months ago expecting and now needing a refund. They've received federal money back, but not Rhode Island. It goes on to ask, what is the average time frame for a rebate?
It's a good question. I don't know right now the average time frame, though I can look into that, but I do know that they are on schedule. So our revenue is not at a place such that we're not able to provide the refunds, and they're doing it as quickly as they can. So if you call in after, I'll get you the number of days that it's taking us. But if you're expecting a refund from the state, you're going to get it, and despite the fact that our revenue is down, in no way impairs our ability to pay back your refund.
Next question is from Stephen Klampkin. Will you invite public input into the decision-making through these phases of resuming economic and other activities?
Yes, in fact, I encourage it. There's a place on the website, which I just revealed, asking for feedback. So I would encourage you to do that, particularly from small businesses. Stefan's doing an incredible job talking to industry associations, being on the phone with groups of hairdressers, groups of restaurateurs, etc. But if you have feedback, I would encourage you to send it to us, and that's exactly why we put a place on the website for you to do that.
Matt Allen from WPRO Radio asks, Governor, you mentioned collecting data between the phases. How much time do you think we will need to get enough data to make a decision as to whether to move on to the next? In a perfect situation, how much time would this all take?
Yeah. So, Matt, one of the things that we've been working very hard to build is basically a dashboard which allows us to collect data constantly. So at this point, every single day, we get data around number of hospitalizations, number of tests, number of ventilators being used, number of ICU beds occupied, et cetera. We can test. We know on a daily basis how many contacts were traced, how long did it take us to complete a case investigation. So I get those on a daily basis from the day before. And as I said, what we're looking for is trends. So we're looking over a 14-day period, what is the trend? And that's as good as anyone's going to get right now, and I feel confident that that's good enough for us to have for data around making decisions, with the big caveat that as things change, we have to change. The good news is, because we've worked so hard over the past month and a half, We have a pretty good handle, like we're tracking mobility data. Mobility data is a good leading indicator as to are people following the social distancing rules. If not, you're going to see a spike. At the other end of the spectrum is, of course, hospitalization data, and then there's different benchmarks in between. So we've developed a system to get data on a continuous basis, and I'm sure it's better than most states. It's as good as any state. It gets better every day. And I feel confident. I wouldn't be saying we could go back to work if I didn't think that system was at a good place.
Ryan Belmore of What's Up Newport asks, what does domestic travel in and out of Rhode Island look like in each phase? At what phase does the 14-day quarantine order end for visitors?
Yeah, it's a good question, and the honest answer is we're still working on it. This is a big deal. So two things. One, I'm in almost daily contact with the governors in this region, and my chief of staff and Dr. Alexander-Scott and Commerce Secretary Pryor are in daily contact with those other governors' teams. Everything we're doing, we're going to try to collaborate within the region. Travel is something we're going to try to get aligned on with the other states. Secondly, the 14-day quarantine, I want to remind everyone, is absolutely in place now, absolutely in place for the next 2 weeks, almost certainly going to continue to be in place in phase 1. So I don't want anyone to start to think about the relaxation of that. Border control, for lack of a better term, is a big deal. I don't know the right answer today. It is complicated, it is complex. We've seen it all over the world, that if you don't get that right, you can run into trouble. So we need some more time to figure it out.
Perhaps you both might have a response for this next question from Tara Granahan. Home health care workers say they are not fully equipped with PPE and feel ignored while continuing to go to work in other people's homes every day. Your thoughts on this?
Yeah, we understand that home health care workers are just as critical to our infrastructure and workforce, and are oftentimes connected to the same workers who are working in congregate settings, either the same people or connected to that group. To that end, we have wanted to make sure that folks who work also at a nursing home or other congregate setting have the PPE that they need, and will continue to and welcome the feedback of concern for those who are entering homes if there is someone that is COVID positive that they are caring for. We've wanted to make sure that PPE is available to them. We're also working with leadership across the congregate settings to continue to collect information on workers who are working in multiple facilities, whether it's other home health agencies or other congregate setting facilities. Collecting that information also helps us be pinpointed in making sure that PPE is available for the people most at risk. So this is a priority that we want to continue to address, as we have an amazing team working overtime to make sure that we have enough PPE in the state for our prioritized groups, such as healthcare workers in entering homes and in congregate settings.
Thank you, Doctor. Next questions for the Governor from John DePietro. Brown University President Paxson wrote an op-ed for the New York Times warning dire consequences if colleges and universities do not reopen this fall. Did you read it? And what can you tell students about plans for URI, RIC, and CCRI for the summer and the fall?
Yeah, great question. So I did read it. Furthermore, every Saturday, Stefan and I have a phone call with a different group of leaders, and President Paxson's been on that call, and I want to thank her for that. You know, what we are going to do, what I'm going to do at some point, is require all of the colleges and universities to provide to the state their reopening plans, just like I did last week with hospitals. Last week I said to hospitals, we'd like you to get back into the business of doing non-critical procedures, non-critical surgeries, and I gave them a deadline of today, actually, and they all get their plans in. Today, we are reviewing all of their plans to see if they can reopen safely. What's the infection control plans, PPE, staffing, et cetera. We're going to do the same thing for colleges and universities. Right now, we're formulating what the elements of a complete plan are, and we're in constant contact with higher education, certainly, obviously, URI, CCRI, and RIC. We'll have them submit our plans, and we're going to work with them so that they can reopen. I agree. I would like them to reopen. The question is exactly how, what does it look like, what kind of testing has to be in place, how are they going to handle non-U.S. students, will it be a combination of distance learning and in-person learning, how are they going to deal with their dormitory living. So I'm on the same page that it's a goal to shoot for. And as I say, there's a mountain of work between there and here and there to make sure that we can do it safely. I also think it's important to give universities some flexibility. So every student population is a bit different, and we need to account for that and give them some flexibility. I know some universities, not in Rhode Island, they're thinking of starting, teaching for 9 months, but not necessarily starting in September, maybe pushing back the academic year. So we'll work with them, we'll be flexible, but I share the goal. I think it's right.
Tanya Signori of the RI Echo says, recently, President Trump made an inaccurate statement about an incorrect way to use a disinfectant. The medical experts by his side stayed quiet. They could have corrected him then and there, but chose not to. Why are key people not stepping up? What are your thoughts?
So, Tanya, you'd have to ask them. You'd have to ask them. I also saw that and was shocked that the president suggested we ingest bleach in order to keep ourselves safe. I would strongly advise you not do that. Here's what I can tell you. Here in Rhode Island, I am listening to the experts. Nicole and I talk constantly. She has a team, she has a top-notch team of public health experts who she listens to and who I listen to. We're in touch with the experts at Johns Hopkins. We're in touch with the experts at the CDC. We're in touch with the experts at Brown University and Lifespan and in Rhode Island, many of whom are world-class. At no time have I gone against their guidance. I listen to them, and they are absolutely free. The reason you don't see us fighting up here is because we work through it together ahead of time. And I'm following their guidance, and we're going to continue to do that the whole way through. So I can't speak to what's happening in Washington, but I can absolutely assure you that that's not what's happening here, and we speak with a unified voice, and we're going to give you the best information we can.
Next question is from Ethan Shorey of the Valley Breeze. The Breeze-sponsored state spelling bee was postponed on March 13th. Do you see any path for us to host a bee with about 25 participants and another 25 parents in attendance and socially distance? Or might such an event be considered too dangerous? Should we end our efforts for this year?
That is heartbreaking, Ethan, to have to read that, because my heart goes out to these kids. I think you need to find another way to do the spelling bee and do it virtually. As I said earlier, I hope 2 weeks from today to say that we could have social groups of 10 or fewer. I don't know if we can, but I hope so. And then we're going to have a couple weeks there before we can go to 15. So it's not going to be 25 for a while. And we ought to work together to give the kids a chance. And I think let's get to work and let us help you, if we can be helpful, to have it be virtually done so the kids can have a good experience and do it safely.
Our next question is from G. Wayne Miller from the Providence Journal. On April 16th, the governor presented 2 projections for COVID-19, a worst case in red and a best case in blue. Where do we stand with those numbers, including projected deaths today?
I need to come back to you, Wayne, and if you call in today or we can call you back later, I can give you the number. I just don't have it off the top of my head. Here's what I do know. I do know this, which is what I've been saying every day. We've started to plateau. So instead of seeing a line that we've all become used to, which is like this, our line's kind of looking like this, and that's a great thing. The question is, will we continue to stay like this? And based on everything we know, mobility is down, people are obeying the order, and I have every reason to believe, if everyone continues to stay hunkered down, that we're going to see a plateau and maybe even a decline in the next couple weeks. In fact, I'm banking on that, which is what tells me that I think on May 9th we can lift the stay-at-home order.
Ted Nisi from Channel 12 has our last question today. A viewer watching at home just reached out to me to ask whether you will recommend church services can resume on May 9th if the stay-at-home order lifts.
Yeah, great question. So, two things. Today, I've given you high-level guidance on where I see us going. You're going to have a million questions. What about churches? What about this? What about that? I'm going to be coming back to you later this week, next week. Remember, we have 2 weeks ahead of us. So I'm going to try to come back to you. Here's what we're doing on childcare. Here's what I recommend on churches. Here's what we recommend for office-based settings. And put that information out as we're developing it and in a way that I think is easily understandable. Churches will be a category. I think I'm very likely to ask churches in the same way that we did with hospitals and colleges to show us your plans. I would say I cannot foresee a scenario in which we'll be able to go to church in phase 1, at least not in the way you think of it as going to church. What we're going to try to do is figure out a way to allow some services, maybe at the end of phase 1, maybe at the beginning of phase 2, with just a whole lot more social distancing and cleaning protocol and different regulations. So, long-winded way of saying, my goal would be in the month of May to allow church and religious gatherings in some form or fashion. And we're going to work really hard in the next couple weeks to figure out how to do that safely.